Hi everyone, I'm Swasti and today we'll talk about a very common topic, that is frozen shoulder, which occurs nowadays very commonly. We come across with lot of patients who are suffering from frozen shoulder. So as a physio, I'll give you little pointers which are essential that one should know, that will refresh you if you are already aware of it. Okay, now starting with it occurs in glenohumeral joint, okay, in which the joint is extremely painful and it is stiff. It is also known as adhesive capsulitis, in which our capsule becomes stiff. So all the changes are occurring within our capsule. Okay, it is common in patients who have diabetes. As you know, diabetes patient, their occurrence is more and more. Okay, now there are two causes, primary and secondary cause. Primary cause being etiological cause, as you know, there is no specific reason of it, and secondary cause in which is traumatic. So frozen shoulder occur right after secondary cause. Okay, now we have three stages in which we'll describe the clinical features. So three stages, I can explain you all the clinical features. First being the painful stage, which starts within 2 to 9 months. It is very painful stage in which it has insidious onset. So one is in extreme pain and it is progressive, which will lead to the second stage, which is stiffness. Stiffness occurs for 4 to 12 months and there is loss of range of motion and pain is there, and muscle atrophy starts in this stage. Okay, now being the third stage, that is thawing stage, in which the actual frozen shoulder stage. In this stage, this shoulder is extremely stiff. The range of motion is not there. We have limited range of motion in this stage, and one thing you should know, in this stage being the last stage, there is no pain, obviously, as the muscle is adhered and there is muscle atrophy occurring. So how will you diagnose all those things? There are three factors which you can rule out how frozen shoulder can be detected or diagnosed. First being internal rotation. If person is able to do internal rotation, he's able to place his hand up to the sacrum. So we can say, if the person is not able to do that, he's suffering from, or he or she is suffering from frozen shoulder. Second being 50% of loss in internal rotation. If there is 50% loss of internal rotation, one can state that there is starting, or the frozen shoulder has been occurred. Okay, third being there is not abduction beyond 90 degree. If person is not able to do abduction beyond 90 degree, one can say is occurring or she's suffering from frozen shoulder. Now being the treatment, how can you treat a patient with the frozen shoulder? So we being a physio will always start with physiotherapy, will not recommend any kind of medicines. So physiotherapy, first of all, what we'll do, we'll go for thermotherapy. Okay, we can go for hot moist pack, ice pack, or hot pack, depending upon the stage the person or the person is have came to us, and what stage the person is in, and according to that we can recommend the person with thermotherapy, what kind of thermotherapy we should give. Now what else you can do? You can do various kind of manipulation. Obviously we have different type of mobilizations which can help in increasing the range of motion and also helping in decreasing the pain. So we can do mobilizations. Okay, we can do secondary exercises. So secondary exercises include pendulum exercises, which is stated to be extremely helpful in patients who are suffering from frozen shoulder. We can ask them to do shoulder pulley and shoulder wheel. So pulley and wheel, both the things are beneficial in patients who are uh, suffering from frozen shoulder, and again we can help the patient or teach the patient for shoulder ladder exercises depending upon the physio, what all exercises the physio will recommend. One being and the other thing being therapeutic modalities. We have different modality to decrease the pain as well as to re-educate the muscle. So accordingly we can treat the patient. There are various surgical things are also there present, but one should stick to physiotherapy. Me being a physio will help you as much as I can. Thank you so much. This was little about frozen shoulder.